This morning on Houston Newsmakers, the focus on breast health and the local efforts to save lives. Now in its 25th year, Susan G. Komen Houston is known for its annual race for the cure, but much more goes on the rest of the year, granting millions to more than 20 local organizations to treat the uninsured. The Breast Health Collaborative of Texas is one of the organizations formed as a result of Komen's efforts. How that organization is helping women across the state and the Baylor doctor on the front lines of breast cancer research and care. And tomorrow is the day we set aside to honor the life of Reverend Dr. Martin Luther King Jr. The North Houston Frontiers Club annual breakfast is ready to honor Dr. King and provide scholarships to Houston youth. How you can help this morning on Houston Newsmakers.
From KPRC Channel 2, this is Houston Newsmakers with Cambrell Marshall.
Good morning and welcome to Houston Newsmakers, where this morning we're going to talk about breast cancer, the fight against it, the challenge of finding a cure, and the efforts to make sure men and women know what they need to know to help in the fight against this disease. Joining me this morning, Debbie Scanlon, the board chair of Susan G. Komen Houston, which this year is celebrating 25 years of raising money for the fight against cancer. Dr. Polly Niravath, who is with the Baylor College of Medicine's Lester and Sue Smith Breast Clinic and a board member of the Breast Health Collaborative of Texas, and Gretchen Walton, the executive director of the Breast Health Collaborative of Texas, which since 2007 has worked to increase access to breast health care and treatment for medically underserved women. Thank you all for being here this morning. Appreciate it. It's a very important topic for us to talk about. First of all, the basics. What is the mission of Susan G. Komen?
Susan G. Komen's mission is to raise funds to get education, raise awareness about breast health, and get mammograms, help the underserved and uninsured in our communities, in the 7 communities around the Houston area.
I know we raise a lot of money. I say we because I'm on the board, full disclosure, of Susan G. Komen, but this is the topic that I, like you, I know I'm interested in, that a lot of the money that's raised stays here in this area, does it not?
It does. It goes to locally 20 organizations in the Houston area. There are funded partners that provide those services to the underinsured and or the uninsured and the underserved.
Dr. Niravath, for those who may not know, what is the Lester and Sue Smith Breast Clinic, and how does it help to offer cancer help to those who are diagnosed, who may be in the, quote, underserved community?
So the Lester and Sue Smith Breast Center is actually composed of 2 separate clinics. So there's one clinic, which is actually called Baylor Clinic, located in the medical center, where we see any variety of breast diseases, including breast lumps, breast pain, and the majority of what we see is breast cancer. So we help people through that journey from the beginning of diagnosis, through treatment, to survivorship and beyond. We also have another center, also called the Smith Breast Center, that's located as part of the county facilities. And over there we see patients who are largely uninsured, some of whom are undocumented as well. These people cannot always afford health care without insurance, and we offer them the same quality health care that we offer over at Baylor Clinic for our insured patients. We can offer them the same cutting-edge treatments, the same clinical trials, and the same high quality of standard care.
And I've been there and I've seen that being applied, and I know that when you walk in, there's no difference in terms of feel at a, quote, clinic that is a county facility, basically, than there is from the other high-quality care.
And that's something that we, as the physicians, the nurses, and the coordinators take pride in, as well as the patients, too. And you can see that in the level of the interaction that we have. Yeah.
Gretchen, tell me, how did the Breast Health Collaborative of Texas, how did that, by the way, that's a mouthful. But
it is a mouthful.
How did that start, and how have you made progress since you did start?
So the Breast Health Collaborative of Texas, or BHC Texas is what we call it, was the brainchild of Dorothy Gibbons at the Rose and a lot of the other organizations in town, including Komen, back about 2005. And they wanted to have a conference, an educational conference that kind of brought everyone together so they could discuss breast health and breast cancer and see how we could all help each other. So it's grown from that and some initial grant funding to an organization. So it was basically a program of the Rose and Komen that's come forth to be a statewide membership organization of over 3,500 members. We provide assistance for mammography screening in the underserved parts of Greater Harris County.
Well, just to put things in perspective, according to the Susan G. Komen website, last year there were almost 232,000 new cases of invasive breast cancer. These are new cases, not recurrences of cancer among survivors. And there were 40,290 deaths. There were also 440 deaths among men with breast cancer among those 2,300 new cases. Yes, men with breast cancer. So what's the first step in taking those numbers down? Research, actual care? What should women do to take care of themselves? As NBC correspondent Ann Thompson explains, the newest recommendations about what to do seem to add to an already existing confusion.
The ever-shifting guidelines for starting mammograms leave some women feeling like they're playing a game of chance. Age 40 and once a year, says the American Congress of Obstetricians and Gynecologists. 45 and yearly is what the American Cancer Society recommends. 50 and every 2 years is today's updated recommendation of the U.S. Preventive Services Task Force. The government advisory panel says screening for women in their 40s can be effective, but it's an individual decision.
In the 40s, we find that the benefit, is smaller, okay, and that there are also harms.
Those harms, the task force says, include false positives, which can be expensive financially and emotionally. These three groups don't agree when to start, but do agree a woman's risk increases gradually during her 40s. All the different recommendations have 35-year-old Susan Fisher, mom to 2 boys, confused.
Blood pressure's good. I mean, I have a young family, and I want to make sure that I'm okay to be there for them. What age is the right age?
Dr. Jill Moore-Rabin hears the confusion from women every day.
Mammography is not a one-size-fits-all. Your dad's mom.
She gets a detailed history from her patients, looking far beyond the family tree.
What are some of the questions you ask your patients?
What's your environmental exposure? What kind of work do you do? Are you exposed to toxins?
She urges her patients to start at 40. Despite the task force suggesting women start a decade later, by law, most health plans must cover the screenings from 40 on, if that's what a woman and her doctor decide.
All about what the woman and the doctor decide. It could be kind of confusing. Dr. Nirvath, what do you tell women who may be confused about that?
Yes, and I agree. It is a very confusing subject. And I wish that there were just one answer for every woman that we could give, but that's really not the case. So the evidence tells us, and even the United States Preventative Services Task Force, who's made the recommendation to start at age 50 and do every other year, they do acknowledge that there are deaths prevented when we start mammograms at age 40. And the numbers that I tell patients are that out of 10,000 women who are screened with mammograms, if we start screening at age 40, we can prevent about 4 deaths. When we start screening at age 50, in that group, we're actually preventing about 8 deaths per 10,000 women. So these numbers are small, no matter how we look at them, in the large scheme of things. However, obviously, the problem that we have is that we can't identify those 4 women very accurately out of those 10,000. As we move forward and as we get more information about actually understanding truly what risk factors are, and as we get better at predicting who will actually get breast cancer, I think that our sophistication in this is going to improve dramatically.
Gretchen, we were talking earlier, and you said the fact that this is being talked about is not necessarily a bad thing in terms of raising awareness about.
Absolutely. There's folks on both sides of the coin. Should we really go to biannual screenings after age 50? And I think the vagueness in the language actually helps us, because I think in well-insured populations where women are doing everything they can for themselves, biannually, if you're speaking with your doctor, may be a great thing. But for a lot of the underserved population I think we're seeing in the greater Houston area, sometimes it's their first step to access to care. And I hate to deny someone that access to care if we can get them into some sort of health home and get their first mammogram. That may make a difference.
I know, Debbie, I know the common conversation a lot of times around the table, it's all about, okay, whatever the rules and guidelines are, okay, that's one thing, but we just need to get women to a place where they can get the support they need.
That's right. That's right. We're trying to push them towards getting the health care they need, knowing even though they're underserved or they're uninsured, they have places to go, and it's matching them up with our funded partners that we're giving the grants to try to give them that access. And like you were speaking to, having it feel like it's the same as everybody else, even though they're coming to clinics to get the help they need.
Well, I love the fact we're having this conversation. We've got much more this morning as we talk about breast cancer and the fight against it, including the results of the Breast Health Summit, the 11th annual summit held recently. Its goals, its results, and what's next. That's coming up when Houston Newsmakers continues. And welcome back to Houston Newsmakers, where we are talking about the collaborative way that dozens of organizations are coming together to create effective ways to fight cancer and get the word out to all women about ways to stay healthy. Late last year, the 11th annual Breast Health Summit was held right here in Houston. All of you were involved in that event. It's been coming around every year since the idea first came about. What was the goal this year and what was your takeaway? Doctor, you're the co-chair, so go ahead.
Yes. So I co-chaired the summit this year with Jane Marmion, and our basic goal of the summit every year is to help providers all across Texas provide the best breast cancer care for all of their patients, regardless of their station in life or their ability to pay. So it's really about understanding what the resources in Texas are for breast cancer, helping us to break down common barriers to getting care in a timely manner and getting the appropriate treatment to the right patients.
I guess it would help to know some of, just some of the organizations that are involved, because that kind of gets the kind of demographic lay of the land, if you will, as to how many different people are serviced. Name a couple of the other organizations, other than Rose and Komen, who are involved in.
Sure. A lot of the pharmaceutical companies and federally qualified health centers and charity clinics around the city are involved. Baylor is involved. Avon Foundation for Women is involved.
So a lot of the organizations that touch the lives of a lot of different women, ultimately.
Yes, and also educational groups. Houston Community Coleman College provides our continuing education credits for social workers and nurses and mammography techs and community health workers. We've turned this let's all meet around the table and discuss breast health in Houston to an educational conference with continuing education credits.
Now, this particular summit is not open to the public, general public at large, right? It's for the organizations so that the organizations can be more effective in getting the word out and shaping their message?
That's correct. And like she said, going through the Komen College to provide them the credits and the education that they need that's up to date and get them in the here and now.
I find it amazing when I talk to doctors like you who are there on the front lines, just going through, and it's such a long process, is it not? When you're deciding, you're finding ways to cure cancers, the process is so long. I guess we're in such an instant society. We want things right away. Talk about how long it takes when you're dealing with various kinds of treatment, from first testing to putting into the actual system.
That is very true. You're right. I mean, it's a very long process from the time that a woman first may suspect something to the time that we actually can complete her treatment and declare her cancer-free. So initially, obviously, there's the first workup that begins with a mammogram and then a biopsy. And then depending on the stage of the cancer, sometimes we'll even have to do treatment before we can move on to the surgery after the cancer is diagnosed. So depending on the type of cancer and the stage that it is, we sometimes do treatment for up to 6 months ahead of time, whether it be chemotherapy or anti-hormonal therapy, to help shrink the tumor down and maximize our chance of success at the time of surgery. And then after the surgery, often radiation is necessary. And then after the radiation, many women often have to take 5 to 10 years of a hormonal therapy that actually blocks estrogen in their body and prevents the cancer from coming back.
Because all of you know about that process, how much easier does it make it for you to be able to help others who are going through cancer, breast cancer?
Well, it helps a lot, because the first stage of what Komen does is the education piece. I think there's a lot of knowledge that you can share with people that let them understand how important their breast health is, and for them to understand their own breast health so that they can go out and get some care and get the mammograms. And I think a lot of them don't understand. They're not used to, especially in the underserved, that it's important for me to take care of my breast, what that means to me and my health and my future. And I think the education of what that process looks like, and it maybe makes it not so scary for people.
How important is it to have the support systems in place? It seems to me that when a woman is first diagnosed, first of all, they're scared, and then understanding maybe there's help, and there are other women who've gone through this, and Collaborative is in a position to really make that help.
We do. We have general membership meetings where we get the community together and folks that are in the breast health area to talk about issues and provide support and share resources. We all have ways that we're helping survivors and the newly diagnosed or getting mammograms in the community. We can share those resources amongst the rest of the groups. We're there to provide support. I think everyone knows someone who has breast cancer.
How are you funded?
We are funded through grants and donations. Our biggest grant is through UT School of Public Health. We have a grant to provide About 2,000 mammograms throughout the greater Houston area. So we're very much grant funded.
Dr. Niravath, the money that provides the support for the organizations that you're involved with, is that government money, is that grant money, is that donations, a combination of all of that? How does that happen?
It really is a tremendous combination of all of it. So thankfully, a lot of the programs that we're involved in to provide care to the underserved are funded by generous organizations like Komen, like Avon, and we also have grant funding from federal programs, like from the National Institutes of Health. I think there's a very large need in the community that's recognized, and thankfully there are many places out there that are willing to help fund this care that's so important.
Debbie, the Coleman's celebrating number 25. 25 years, a lot going on, and we've raised literally millions every year. And is there going to be an adjustment to try to raise even more in this 25th year?
Well, of course. We're actually going to celebrate the 25th year here in February 20th with a large gala, kind of a 25th year gala, which I think should be a huge success. We're obviously raising funds as a part of that. And it's being hosted by Jane and Ed Parker, and along with Judy and Glenn Smith, and we're going to pull together and hopefully help to raise funds and then kick off another great 25 years raising a lot more money.
Well, I hope that that happens, and I hope that the monies raised will be put to great use, helping all the research that we need here. I want to make sure I put all the information about all of these organizations on the Newsmakers section of our click2houston.com website. Please go there, get the important information you need that may help save a life, quite possibly your own. Ladies, thank you so much. Debbie, Dr. Niravath, and Gretchen, thank you so much for being here this morning and helping get some information out, getting this talked about a little bit more. Hopefully our audience was able to gain something from it. Hopefully. That's what we do every morning. We hope that we can make a difference. Thank you again.
Thank you.
Just ahead, getting ready for the Martin Luther King Jr. holiday and what that means. The North Houston Frontiers Club annual breakfast, what's on tap for tomorrow morning, and how you can help children in our community. That's next when Houston Newsmakers continues.
From KPRC Channel 2, this is Houston Newsmakers with Cambrell Marshall.
It's an annual event that goes along with the celebration of the Dr. Martin Luther King Jr. holiday, the MLK breakfast put on by the North Houston Frontiers Club for the past 27 years, and looking for number 28 tomorrow morning with the goal of raising enough money to continue to provide scholarships to young people in our community who need them. Here this morning to talk about this event, Donnell Cooper, president of the North Houston Frontiers Club, and Corin Williams, co-chair of tomorrow morning's breakfast. Good morning to both of you.
Good morning. Good morning.
Number 28. It seems like we just had 27.
Yes, sir. They roll around pretty fast.
Let's talk about what this breakfast is all about and why it's so important to be a part of this community. What's your main focus every year when you put this breakfast on?
Of course, our main focus is to allow the community to know the importance of our platform, which is education. And so all of our dollars from this event go back to our scholarship opportunities. And so we want Houston to know that there's a wide opportunity for them to get involved to help local students in Harris County provide local education and scholarships.
And you were once one of those students, and you're co-chair this year. That's a pretty interesting dynamic that you, as a former scholarship recipient, are now co-chair of this year's breakfast.
Yes, I was a scholarship recipient back in 2003, and I've been a member and held office on the board for the past 5 years now. And
so what did you do with that scholarship? You're now in what field?
I'm now in the field of mechanical engineering, and I'm actually attending University of Houston currently to receive my master's in subsea engineering.
Okay. So that scholarship works. When you see something like that, you get really proud.
Definitely proud. I mean, Corin's been a great opportunity, a great, product opportunity to show our community that our dollars are going to good use.
How is it difficult on that day, because there's so many things going on? There's a lot of activity with parades are all over the place and other activities for you to be able to. Is there a competition going on in terms of?
Well, we're in a lucky position, because we host the largest MLK celebration, so we have the privilege of having all of the dignitaries. We have our new mayor, Sylvester Turner. And so everybody's kind of getting kicked off with the breakfast, and then they kind of start the festivities with the parade and everything. So we're kind of not in the competition, so we're in a good position.
When you were growing up, Corin, in terms of this particular breakfast and the scholarship you received, was the Martin Luther King holiday, what did it mean to you, and what do you hope others will take away from this event in terms of what it does mean to the community?
MLK Day, growing up, it meant a great deal to me and my family. I actually spent a lot of my formative years attending this particular breakfast, and what it was to me was a celebration and a time to take a moment and remember the past and the things that have transpired to get us to where we are today. And I take that as a personal challenge. I know the club does as well, to take that and continue with it moving forward and passing that on to the next generation.
I've been to the website and I see the number of students who benefit from this.
Definitely.
And they definitely represent a slice of Houston. I mean, you look at them, you say, well, that's Houston.
Yes.
And those are the children, and that seems to be what you focus on day in and day out. Not only the breakfast, but all year long.
All year long. You know, all of our initiatives go to our students that live in Harris County, and that's one of our stipulations that we take a lot of pride in, that a lot of our product is coming directly from Harris County.
I want to make sure that people have information about the event tomorrow morning. I'm assuming people can still get tickets.
Tickets and tables.
Okay, there you go. It's at the Hilton Americas. Starts at 8 o'clock. They open the doors. I think you're going to start at 8:15.
Yes, sir.
Yeah, but 8 o'clock, be there. $50, or you can just make a donation even if you can't go there. For more information, either call 713-331-0440, or better yet, go to the website, nhfrontiers.com. Did I get it right?
Yes, sir.
That's a good deal. If you can't get there, it's a great opportunity. Donnell Cooper, thank you so much. Appreciate it. Mr. Williams, thank you so much. Congratulations so far on what's been going on in your life. Appreciate it. All right, well, for your final thoughts just ahead, we're going to tell you something about how the Texans' loss in the playoffs has no impact on Houston's chance to perform well in the Super Bowl. I'll explain when Houston Newsmakers continues. The Texans got slapped out of the NFL playoffs, but Houston's still a big player for this year's Super Bowl, as in S-O-U-P-E-R Bowl. It's the annual effort in Houston and the country to focus on the needs of the thousands who are hungry and food deficient. And of course, Houston is a major part of that. We'll have all the players here next week to talk about it. Thank you to my guests for joining me this morning. We'll see you back here next Sunday.